Paolo Matutina and I will be your nurse for today. So, sir, may I know your name, please?
My name is Albert Carrillo.
Okay, so for today, sir, I will be assessing your genitals, sir. So, is that okay to you, sir?
Yes.
And I will ask some few questions for you, sir. Is it okay to you, sir?
Yes.
Okay. So first, sir, have you experiencing pain, lesions, and lumps to your genitals, sir?
No.
Okay, very good. And sir, have you experiencing difficulty of urinating, sir?
No.
So okay, good. How about on pain, sir, during urinating, sir?
No.
So okay, very good. So how about sir on your rectum, sir? Have you experiencing? Do you have lesions, ulcer, lumps, rashes, and etc., sir? Redness. Okay, very good. And sir, have you tested on HIV, sir?
No.
Okay. How about sir history of blood and stool?
No.
Okay. Sir, have you recently engaged on sexual activity, sir?
No.
Okay. So, sir, may I know how is the color of your feces, sir?
Brown.
What, sir?
Brown.
Okay. Sir, please relax and prepare for the examination. Okay, sir? Okay. So, first, inspect the patient's genital if the shape, size, and position of the penis of the patient. So, okay. Inspect the base of the penis and the pubic hair of growth pattern and excursion. Infestation of the patient while standing. So let us now inspect it. Okay. Okay. So far I didn't see any lesions on the pubic hair. So next, inspect the skin of the shaft for rashes, lesion, and any abnormalities of the patient. Okay. 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 It is normal. So there, I don't see any shaft or in the shaft, I don't see any lesions or any abnormalities of the patient. So next, inspect the skin of the patient for any rashes, lesions, or lumps, and or any abnormalities of the patient. Okay. So okay. While inspecting, I don't see any rashes or lesions or any abnormalities on the patient's skin on on his genitalia. So next, palpate the shaft of the patient for hardened areas or for any tenderness. Okay. Okay. So while palpating, I don't see any tenderness on the shaft of the penis or any abnormalities. And next is inspect the foreskin of the patient for any abnormalities. So okay. So I don't see any abnormalities on the patient's foreskin. So next, inspect the glands of the penis of the patient for any lesions, redness, and etc. or any abnormalities. Okay. So So after that, palpate the urethral discharge for gently squeezing the glands between the index finger and the thumb of the thumb. So, sir, can you please hold your glands like parang ganito po. Okay. Yan na po, sir. So, while pinching the glands of the patient, so I don't see any. The generalimetrius is round, so I don't see any abnormalities on urinary meatus or the glands. So next, we are now going to the scrotum of the patient. So first, inspect the size, shape, and position of the penis on held out on the Y. So, okay, we will now inspect the. So it seems normal naman, wala namang abnormalities sa size and shape of the scrotum of the patient. So after that, observe for swelling, lumps, and bulges on the patient's scrotum. So, sir, observe po. So while observing, it seems normal again for walang swelling, lumps, and any bulges of the scrotum of the patient. Then after that, inspect the skin for color, integrity. Inspect the skin for color, integrity, and the presence of any lesions or rashes on the scrotum of the patient. So, sir, can you please i-inspect ko lang po ito ang scrotum ni sir. Okay lang po, sir. Okay lang po, sir. Ako na po, sir. Sir, okay, hawakan niyo po. So, while observing the scrotum of the patient or inspecting the scrotum of the patient for any discoloration or any integrity, so the color seems okay naman and there's no abnormalities, there's no lesions and rashes on the scrotum of the patient. Now, let us now proceed to the palpation of the scrotum. So, we are now palpating the scrotum for medularity, masses, any lesions, and tenderness, etc. So we also palpate the testicle cord to feel firm and to check or para makita natin kung it become larger or small. It becomes smaller. Kung lumiit siya. So, okay. So we are now palpating the scrotum of the patient. So, ako na po, sir. Okay, we are now palpating the cords. Okay. Right. The spermatic cord of the patient. Okay, hold it now, sir. So, while palpating the scrotum of the patient, so I don't see any abnormalities. So, I don't see any swelling, nodules, or any abnormalities on the scrotum of the patient. Using the pen light or the flashlight, we will now transient illuminate the scrotal contents for any have mass, swelling was noted. So now, okay. So next po. Ako na po, sir. Okay. So while transinumulating the scrotum of the patient, I didn't see any blue dot sign, solid lesions on the patient's scrotum, and I don't see any red glow. I don't see any abnormalities on the inside of the scrotum of the patient in internal. So overall, his scrotum is normal naman po. Let us now proceed to the inguinal area. So, sir, can you please bear down? Okay. So next, okay sir, can you please turn your head to the side and cough? Medyo lakasan mo po, sir. Okay. So, okay. There's no any nodules or any palpable masses on your inguinal part, sir. Can you please bear down for me, sir? Okay. Can you tilt your head on the other side and cough po? Medyo lakasan mo po, sir. So, okay. We are now done on the physical assessment on your genitals. So, based on the findings, while assessing your genital, the findings are normal. Your scrotum in your penis are normal. So, overall, it is normal. So now, let us now proceed to the anus and perianal area. So, sir, can you please lay down, please? Sige po. Yung paano po? Sige po, side pa po. Yan. Now, first, inspect for lumps, ulcer, lesions, rashes, redness, and also note the size, shape, location, and distribution and configuration of the anus and rectal perianal of the patient. So, first we will now inspect the texture kung meron bang naka-usli or meron bang may dumudugo ba dito sa part dito ng anus of the patient. So, okay. So, assuming that this will be the anus of the patient, so the findings are none. It is normal. Wala naman masyadong sugat and walang masyadong abnormalities. So, and next, inspect for rectal prolapse with Valsalva maneuver. So, sasabihin natin sa patient na takpan niya ang ilong and bibig niya and mag-i-exhale siya so that ma-inspect natin yung anus ng patient. So, sir, pwede mo bang takpan ang ilong mo at saka bibig? And exhale ka po. Exhale po pa. So, while conducting the patient the Valsalva maneuver, so the anus is normal. So, next is palpate for anal sphincter tone, tenderness, nodules, or hardness. So, we will just check the patient's muscles on the anus. So, we'll now palpate it if the muscle is strong. So, while palpating the patient's anus, so it seems normal. The patient's anus. So, okay. Let us now proceed to rectum and prostate. So, in rectum and prostate, we will be conducting a digital exam. So, we will now palpate the rectal mucosa for tenderness, irregularities, nodules. Palpate the peritoneal cavities for tenderness and molars again. And palpate the prostate glands for tenderness, size, shape, and irregularities. So, we will now inserting our nigger finger. So, we will now palpating it. Okay. The index finger. Okay. So, while palpating the patient's rectum, so it seems normal. So, there's no tenderness, there's no there's no juice or any abnormalities in the anus. So, and again, inspect the feces for blood and perform occult test. So, we will now inspect the feces color if the color is red, green, etc. So, the patient's feces is brown, so it's normal. So overall, the rectum and prostate are normal. So, sir, so what I observed, what I assess on your genital and rectum, so overall, your genital and rectum are normal. So, wala namang problema, sir. So, overall, normal naman po lahat, sir. So, thank you, sir. God bless. So, that's all on assessing the male genitalia and rectum. Thank you.